Welcome, everyone, to Health Authority TV. I am Janan Sarwar. I'm the deputy editor for Health Authority Books, an imprint in partnership between Indie Books International and Global Bookshelves International. I'm very excited to introduce you to Joe Heiderscheit. He is a licensed professional clinical counselor, a licensed professional art therapist, and a registered sand play practitioner, among many, many other things. I'll let him share more, but welcome. Welcome, Joe. Thank you so much for being here.
Thank you. Thank you, Janan. I'm happy to be here. Yes, I specialize in treating people on the autism spectrum with their families, and use art therapy, sand play therapy. Have just written a book that has a psychoeducation curriculum. It's called Autism First: From Chaos to Conduction. And we use this book to also facilitate psychoeducation groups, psychoeducation multifamily groups, psychoeducation parent provider workshops. And we're really excited because that part of this is really fresh and new.
Absolutely. And as a health authority, have you always focused on patients with autism, or how this really unique that you work with the family as well? Tell us more about that.
I've always worked as a professional with the families when
Okay.
I treat clients, but it didn't start becoming fully specialized in the autism population until about 3 years ago. I found that having a specialized curriculum of psychoeducation was what was best for this population, and that it helped me treat the condition better by putting all my energy into just this population. Before 3 years ago, I had treated a wide range of diagnoses and things like that, but always included the family.
I think it's really fascinating your approach to what autism is. And we've talked before at length about the definition of autism and what the world and how the world sees individuals with autism. But can you expand upon that a little bit?
We live in a world that is built for people that have a neurotypical profile.
Yes.
People with autism have a neurodivergent profile. That means that our communication is more comfortable for neurotypical people, our language, even our architecture is built to be comfortable for people who have a neurotypical profile of processing the world around them,
Right.
including relationships. So it's important, I think, that a model be used to be able to help people with a neurodivergent autism profile and their families find stability. And when stability is found, doors open for adaptability, and doors open for more assimilation with the world. But we need this kind of specialized model that is targeting the neurodevelopmental profile of the condition to be able to do that. I think I lost your hearing. I'm not able to hear.
Oh, I apologize.
There
I
it
don't
is.
know how. Yes. So when you work with these families and you're helping, in your words, helping these individuals adapt and assimilate into this world, what kind of tools or services are you providing, or do you suggest so that people understand your approach?
Well, one of the tools is as simple as a self-care schedule. And I think the important thing about the tools in this curriculum are we're talking about individuals. However, the model of tools are more about collective problem solving than they are the philosophy of individualism. So we're talking about a model that is not as much about being a champion, not as much about overcoming, but more about taking a step back, being part of a team, and that the philosophy that two heads, three heads are greater than one. So it's about finding space with your team, your conduction team, to be able to adapt with the kind of pressures that the neurotypical world demands on the neurodivergent person with autism.
That's fascinating. Absolutely. And when you consider supporting these families or individuals, what has the response been? So how do you know what you're doing is working? Because it sounds like you have a very unique approach, and I'm just curious to know what the families come back and say and how it's led you to write this book. So I'm sure tell us more about that.
Many of the families have found it beneficial. Many of the families have reported the symptoms becoming less intense. The intensity of the behavioral, emotional, social, and developmental symptoms in the treatment plans have gone down in intensity. Some of them have phased out. And I'm also getting reports from parents that they're recognizing more cognitive processing and more consciousness in their child's ability to communicate in their relationships with their child. The child is using the vocabulary of the tools more.
Hmm.
And it seems to be a curriculum from this book, Autism First, that is permeating and integrating into the family and the child's way of life, um, almost like threaded into their life. Um, so it's been very encouraging. There's been a lot of parents that have been enthusiastic about continuing to refine their skills and their tools. It's nice to have a situation where many of these families seem to feel inclusion about the materials and the way that we work together. I think many of them look forward to the work. Whereas sometimes with this field of mental health, you may get a sense of being overworked. And I don't generally get that sense with most of the families I work with. Most of the families I work with, they seem to really see the treatment and the psychoeducation as an opportunity to be able to review, reflect, and refine. And they seem to feel very empowered by that. And, a lot of them, I think, look forward to it.
That's excellent. That's excellent. In your book, Autism First, From Chaos to Conduction. So you're implying right now these neurodivergent mind in a neurotypical world, they're living in chaos. And what is conduction? What does that mean to you?
Conduction of energy,
Oh.
conduction of energy. So the family the curriculum is able to explain that the family is a system of care for the person on the autism spectrum.
Mhm.
And that system of care coordinates with the person with ASD to increase conduction of energy. So it's bypassing all the talk and
Right.
it's going more into how their energy is distributed in a way that maximizes endurance and that maximizes their ability to stay oriented and coherent with the world and the environments in the world and the people in the world. And it is a way to maximize resiliency. So when those factors, those core factors of living in the world are stabilized through the system of care, they're done through conduction of energy.
Yeah,
So it's about efficiency, it's about simplifying it, and it's about everybody understanding the importance of the system of care, that they're a team, they're working together, that this is a very much a team model.
that's really fascinating. Thank you for explaining that. And my favorite fun question to ask is if you could redesign the healthcare system in any way and you had your way with it, what would it look like? What would you do?
I think that anything that can be done to make healthcare affordable for everyone and to also provide as much range of different kinds of plans. I think everybody is different and everybody can benefit from having opportunities to build their own definition of success. So being able to customize plans that fit the person or the family, um, and perhaps even family healthcare plans as opposed to individual. Trying to come up with a wider range of options. At the same time, everybody has a chance. Everybody has access to being able to be supported.
That is amazing and something that I'll never forget. I've heard from you and I've heard with another parent that has a child on the ASD spectrum, and it's what you said about everyone's different. And when you've met one person with autism, you've met one person with autism, right? That's the phrase, right? That
That's an old saying. Yeah,
it's,
that's
yeah,
a saying in the autism community.
in that community, in that speaks to the uniqueness and individuality everyone has. So I
Mhm.
think it's really fascinating. Excited to follow along with the work that you're doing, the book that you're publishing, books that you're working on in general. And I really appreciate the time that you gave to come on this podcast. I'm sure we'll be speaking again about this on another podcast, but thank you for coming. And for those listening, until next time, may you all be healthy, wealthy, and wise. Thank you. Thank you again, John.
Thank you so much, Janan.